Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, people of all races and ages get acne, but it is most common in teens and young adults. When acne appears during the teenage years, it is more commonly seen in both males and females. But for most people, acne tends to go away by the time they reach their 30s, but some people in their 40s and 50s continue to have this skin problem. So, to discuss on the topic, we are being joined by Dr. Aruna Devi, specialist in aesthetic dermatology, dermatosurgery and cosmetic gynecology. So, not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So, today the topic which we have taken, we can say that this is the talk of the town and very common topic which we see. So, why does one have acne? What would you like to say?
See, this is so commonly seen in every age group, every races, every ethnic regions, every geographical distribution. But the thing is that yes, this is more common in teenagers, regardless of male or female. But that is physiological, right? But this is a physiological condition, so this is self-subsiding. If you just take good care of your skin, then it resides like itself. But sometimes it doesn't happen like that, and it keeps on continuing and it keeps on aggravating. Okay, there are so multiple factors are there. Why does one have acne? If you say simply, it's because of the clogging or blocking of the pores.
Okay.
These pores, there are innumerable pores over our body, especially over our face, over our chest, upper arms, back as well. These pores are nothing but these are the opening of some oil secreting glands.
Okay.
These glands are called sebaceous glands. The oil secreting substance, those substances are sebum. So these are the materials, they come to the surface, these are secreted over the glands, and when there is overproduction of these oil secretions, they come into the surface, they block the pores, and then over the surface dirt and these sebum materials and some bacteria. We call it 𝗡𝗢𝗥𝗧𝗏 acnes. There is a specific bacteria for this acne. So they mix together, and then they form those eruptions, the bumps we called acne. Okay, this is a disease. Acne is a disease.
Okay.
Like when these glands are actually associated with the hair follicle. So in the hair follicular root, these glands are associated, and then these materials, they keep on concentrating in surrounding the hair follicles, and sometimes on the open pores itself. Then they got blocked, and then they give rise to those acneiform eruptions.
Okay, doctor, we have a caller, so let's take the call first. Hello.
Hi, namaskar. Memor পৰা এটা বস্তু মই জানিব বিচাৰিছিলো মানে কি মোৰ চুলিটো বহুত পাতল কি লগালে চুলিটো মানে অলপমান ডাঠ হ'ব
কি ক'লে
চুলিটো বহুত পাতল
চুলিটো ওকে আমি চুলিৰ কথা ডিসকাস কৰি থকা নাই স্কিনৰ একনিৰ কথা ডিসকাস কৰি আছো তথাপিতো চুলি পাতলা হোৱাৰ বহুত কাৰণ থাকিব পাৰে সেইটো আপোনাক নোচোৱাকে ক'বলৈ অলপ দিগদাৰ হ'ব আপোনাৰ এজটো মই নাজানো বা আপোনাৰ চুলিৰ কন্ডিশন বা স্ক্যাল্পৰ কন্ডিশনো মই নাজানো তো সেইখিনি জানি ললে আপোনাৰ চুলিৰ পাতল হোৱাটোৰ সমস্যাটোৰ সমাধানো নিশ্চয় কৰিব পৰা যাব
All right, thank you so much for calling, and just to tell our viewers that our numbers are flashed on your television screen, so if you have any questions regarding the topic which we are discussing at this point in time, please call up and ask your questions. Well, doctor, coming back to you again, we will have several calls relating to other problems as well, though we are discussing acne, but it might be related to hair, skin as well. Now, if we talk about pimples, now how is pimple different from acne?
Actually, see, this is not different.
Okay.
Acne, what I have already told, is a disease. Okay, it's a pathological problem. It's a physiological condition. When it turns into the bumps and the painful eruptions, then this is acne.
Okay.
And pimples is the symptom. When this is painful, the bumps appear, and you don't look like you want to get it removed. those are pimples. So this is a layman term, pimples, and the acne is a medical term, and this is a disease condition.
Okay.
Right. And sometimes what happens, if the pimples, you say, we can term it as blackheads and whiteheads. So what are blackheads and whiteheads? These are also acne, these are also pimples. But when these pores remain open, or say half open, and these dirts, the sebum materials, the oily materials, and the bacteria, when these sebum materials come in contact with air, and it gets oxidized, and then it causes the blackheads. It becomes blackish in color, dark in color, so it is blackheads. When the pores are totally blocked, the materials, they remain inside. It doesn't come in contact with the air, so it remains whitish.
Okay.
So it is called whiteheads. Though simply these are actually the same thing.
Same thing.
Only
But the
thing
terms
is
are
that the
different.
terms are a
Medical
little bit
terms are
different, according to the stages and the way of presentation.
Okay. Now, doctor, what is adult acne? We see acne appears in teenagers, but if we talk about adult acne, what is it?
Yes. See, teenage acne, we already know these are self-subsiding things. When it keeps on, continuing during the adulthood, even into the, middle age, even sometimes in the later age group also.
Okay.
So this is called adult acne. Teenage acne, well, this is physiological. There are some, multiplication factors, some additional factors, modifying factors. But in adult acne, other factors are there, but mostly this is hormonal induced. Okay. We have got so many circulating hormones, specifically the androgen. Androgen, like male and female both have androgen circulating inside our body, but this androgen hormone is responsible for adult acne.
Okay.
But it is not that hormone level goes up. It's nothing like it. Hormone level remains same. Only thing is that the skin hypersensitivity towards the circulating androgen level, that causes the eruptions. And on top of it, the genetic factor is also there. Some metabolic factors are also there. The environmental factors, the hot and humid climate.
So a lot of factors are there.
Yes, and the cosmetic items, the facials and whatnot.
Okay, doctor, we have a caller. Let's take the call. Hello.
Hello. More at a question actually regarding blackheads. If the blackheads বিলাক হৈ থাকে আমি অকল ফেস ওয়াশ দিয়ে এটা সাফা কৰিব পাৰো মানে যেটো আমি ৰেগুলাৰ ফেস ওয়াশ ইউজ কৰো আহাত গ্লোবলি নে আৰু বেলেগ কিবা তাত মানে ইউজ কৰিব পাৰো ব্ল্যাকহেডছৰ কাৰণে কাৰণ এটো খুব ফ্ৰিকুৱেন্টলি আহি থাকে আৰু যদি ক্লিন আপ জাতীয় কিবা কৰো তাৰ পিছত আকৌ খুব বেছি এদিন বা দুদিনৰ পিছতে আকৌ দেখা যায়
হয় আমি অলৰেডি ব্ল্যাকহেড কিহৰ কাৰণে নহয় সেই বস্তুটো আলোচনা কৰিছো খালি কথাটো হৈছে যে আপোনাৰ যদি আহা গ্লো ফেস ওয়াশ ইউজ কৰি আছে এটো খুবই ভাল কথা কিন্তু কথাটো হৈছে যে হেতু আপোনাৰ স্কিনত টোটালি সুইটেবল হৈছে নে নাই হেতু জানিব লাগিব আৰু ক্লিন আপটো আপোনাৰ কেনেকৈ প্ৰপাৰলি কৰিছে হেতু ওপৰত কথা আৰু যদি ক্লিন আপ একচুয়ালি তো তেনেকৈ ঘৰত ক্লিন আপ কৰিব নালাগে আৰু নৰ্মাল স্কিন মানে যেটো আপোনাৰ ক্লিনিং বা যেটো ময়শ্চাৰাইজিং হেখিনি কৰি থাকিলে সাফিশিয়েন্ট আৰু যদি বেছি অয়েলি স্কিন আছে তেতিয়া হলে আপুনি আপোনাৰ যিবিলাক ফেস ওয়াশ বা ময়শ্চাৰাইজাৰস আছে বা সানস্ক্রিন আছে হেখিনি আপোনাৰ অলপমান সিলেক্টিভ হ'ব লাগিব ফেস ওয়াশ বিলাক আপুনি গ্লাইকলিক এসিড থাকা লব পাৰে ম্যান্ডেলিক এসিড থাকা লব পাৰে স্যালিসাইলিক এসিড থাকা লব পাৰে আৰু যদি হেতু যেটো আপুনি এডিস্টিন যেটো হৈ আছে হেতু যদি ইউজফুল হোৱা নাই বুলি ভাবে তেতিয়া হলে আপুনি ওচৰৰ কোনোবা এজন কাইন্ডলি স্কিন স্পেশালিস্ট ডাৰ্মাটোলজিষ্টৰ লগত কনসাল্ট কৰি পেলে তাৰ নেক্সট স্টেপটোত আপুনি যাব পাৰে যদি আপোনাৰ ব্ল্যাকহেডছ খিনি কন্ট্ৰোল হোৱা নাই আজিকালি বহুত কিবা কিবি সুবিধা আছে হেখিনি কিন্তু চাই পেলে দিব পৰা যায় হেতু নিশ্চয় আপুনি উপশম পাব
All right. Thank you so much for calling. Now, doctor, there must be some types of acne as well. So if we want to get rid of stubborn acne or the scars, so what is the proper treatment or what is the proper procedure for that?
Okay. Say, if it is very mild, only those small bumps, and we call it microcomedones, and the simple acne type 1 or type 2, they can be contained, at home easily. by using a normal proper skincare regime like cleansing, moisturizing, sunscreen, balanced diet, hydration, everything, removal of makeup, everything. So that can be controlled easily. But if it is existing and if it is painful, red, boil kind of thing, those are advanced acnes.
Okay.
So to treat them, you need some particular medications, some antibiotics, some specific antibiotic oral tablets, even some other anti-inflammatory products are also there we prescribe generally. So those you will have to take selectively according to your skin type and your acne type. And then topically you will have to take the proper cleanser, like cleanser with cetyl alcohol, cleanser with glycolic acid, cleanser with salicylic acid, retinol, and malic acid, all those things combination.
Okay.
And your moisturizer should be water based, not oil based, matte finish kind of. It should be skin friendly towards the oily skin. And your sunscreen should be physical sunscreen or matte finish sunscreen. It should also have adequate SPF factor. And some other topical antibiotics are there. Some topical retinoids are there, topical adapalene are there, benzyl peroxides are there. So many anti-acne topical preparations are there. So you have to choose accordingly, and we can prescribe it, and the patient definitely will be
taken care
of.
Now, before all these, doctor,
yeah.
of course there must be some test to rule out the skin type also, that which is being recommended for the patients.
That's why if the acne is persisting and it's not getting cured by your home remedies or your normal skincare routine, you should consult a dermatologist for your proper skin examination, because proper skin type is very important to choose the skincare products. And that is very important, and according to that we select the skincare regime, the skincare products, whether topical or oral. So that is very important. And regarding some test, if it is normal acne, normal pimples, no need of some acne test. But if it is a hormonal acne, if some other metabolic diseases are there, if you suspect, then we definitely have to carry out some specific tests like hormonal assessment, thyroid function, then your liver enzymes, then your ovarian assessment. There is a very common acne association is polycystic ovarian syndrome. So we have to rule out those things particularly. If you have some existing polycystic ovarian syndrome symptoms, then definitely we have to look for those hormone levels to rule out if there is any underlying condition, so that you can treat simultaneously all the things to have a better impact.
Okay.
That is the thing.
All right. Doctor, we'll have more conversation, but we'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on the topic acne. Why does it evolve? What are the treatment procedures? And let's begin with that. Now, doctor, if we had a proper idea, or we can say a basic idea about the reasons behind it and treatment procedures as well. Now, if we talk about the acne pus, which triggers a lot, so can acne pus trigger more in the things which is being ruled out by some of the patients?
See, those pus actually they are a cocktail of the bacteria, the debris, the skin debris particles, and the oils.
Few might be painful as well.
Those are painful, definitely, because the bacterial infection is there, so these are definitely painful. So what happens, these pus, they contain so many dirt materials, so many offensive materials. So if they happen to, come in contact with your normal skin surface, definitely it is going to aggravate your condition. So it's very much, important to contain it, to, correct it as early as possible, because if it is not corrected, if it is not treated properly at the very beginning, it might lead to aggravation of the flare up of the condition. We have a term called acne fulminans, nodular acne, cystic acne. So those are the advanced acne stages, and it might lead to the hyperpigmentation, very bad post acne scars at the later age, and they might give rise to some other like psychological or social impact in one's mind. So this is very important to treat those conditions as early as possible.
Okay. Now, what happens if it is untreated for a long time?
That's what, if this acne, if it is simple thing, it's okay. If it is in the advanced stage, if it is bothering you, if it is not controlled by your normal routine skincare, then if it goes into advanced stages and it leaves behind very bad pigmentation, very stubborn pigmentation, and the scars. Sometimes it contains atrophic scars. What happens that some are the hypertrophic, like the swollen scars, and some are the atrophic scars.
Okay.
So it leaves behind the skin a very bad state. So, and it ultimately what happens when you have these kind of scars, you have got a psychological issue.
Absolutely. People with scars or people with acne
have low
are very
confidence.
conscious.
Yes, low self-confidence.
Yeah, low confidence.
You
They don't tend to go out.
Yes, yes.
Yeah.
Definitely.
So on that note, what kind of like measurements or what kind of like discussions do you do with your patients? Do you have a psychological team with you?
It's nothing like that. We usually advise the patient not to, go up to that stage. You can contain, you can treat the patient as early as possible before it gets worse, and we have to counsel the patient regarding this thing, and we have a very properly spread out treatments for this. Say for acne pigmentation and for acne scar, we have got some advanced treatments, some specific peeling reagents, anti-peeling reagents, anti-acne peeling reagents are there.
Okay.
We will have to use this judiciously to get some better results. So nice results are seen if you do it properly. We can do carbon dioxide laser resurfacing, we can do microneedling, we can do substitution. So many procedures are there. We can do even the fillers. Like so many procedures are there, but you have to choose it wisely, and the combination should be correct for the the problem the person faces. So with the those combination treatments, we can give the person a better life.
Okay. Now we have seen that technologies have advanced.
Yes,
a lot of
yes.
like good equipments are being available. So people might have that confidence that of course we are in the safe hands, or the
Yes.
technology will work on them. So on that note, what kind of like recommendation do you give to the patients who come to your clinic, or what advice do you give to them? You build up their confidence as well, or boost up their confidence as well?
Yes, that is very important, because when a person comes with those advanced stages of acne with those of complications, their self-confidence part is very low. So first thing, we need to counsel the person very thoroughly.
Okay.
Not only we start the medicine, we will have to boost up his confidence or her confidence, so that it can be treated and we can give a better outcome, clean face. But it needs some time, it needs some couple of sessions, and you have to have patience, and you have to routinely, thoroughly follow the treatment properly, so that we can expect a optimum result.
Okay. Now, doctor, do people with oily or sensitive skin only have acne, or is this a myth or something like that?
I can say this is not myth, but the thing is that yes, oily and sensitive skin people have more prone to develop acne, but even the dry skin people, even the mixed kind of skin, because here we have mixed kind of skin very much, they also have, can develop acne. It's the only thing is that their acne may, heal spontaneously, or they may have to take some less care. It's not less care, proper skin care, but oily skin people will have to take extra care, so that their oiliness, because of our humid weather, oil secretion is anyway very much more. So you have to take some extra care. But the dry skin people can also have acne and the same problems.
Okay. Now, there must be some beneficial ingredients also, doctor. So, what are those ingredients? Can you tell us about that to prevent acne?
Yes, actually we have already touched those things. Only thing is that the cleanser should be very proper. You will have to clean your skin as good as possible, and 2-3 times daily. And the cleanser should be, having some anti-acne ingredients in it. That like I told you about the glycolic acid, about the salicylic acid, about those alpha hydroxy acids or beta hydroxy acids preparations. They help in containing the stubborn acne. Then your moisturizer should be, the skin should be well hydrated, not very much dry, not very much oily. The moisturizer should have enough water based and a good composition, so that it can contain the acne. And the sunscreen as well, it should be a matte finish one, it should be a dry type, and it should be a, as much as possible a physical sunscreen, so that it gives a good hydration and good maintenance to your skin, and it will not aggravate your skin condition. And if it is not only controlled with this simple cleansing, toning or moisturizing, you will have to add on some other specific anti-pimple therapies, like the topical therapies and the systemic therapies and those other procedures, those selective procedures what we have.
Okay. So physical activity and a proper diet is also very important.
Very important, very important. Yeah, the diet, if you say, there are some glycemic diets, like the fast foods, the dairy proteins, dairy products basically, and the sweets. All those things are a total no-no.
Okay. And what is the amount of water should put in?
The amount of water, you cannot specify it, but the thing is that your body as well as your skin should be properly hydrated. Then only your skin get boosted up and your skin get proper nourishment. Okay, so balanced diet and good hydration of your skin as well as your body is very important.
All right, doctor, we are really short of time. So, what is your secret mantra for a glowing skin? What would you like to tell our viewers?
Yeah, you actually, for glowing skin, there are some genetic components also. But the thing is that if you take good care of your skin, I can tell some do's and do nots. One is you should properly remain hydrated, the moisturizer should be good, and the diet should be well balanced, and you should, choose your skincare products very judiciously, and you should remain your makeups, if you at all use makeup, just before sleep, before going to sleep. So these are the things, and proper medications. And as much as you should avoid the facial scrubbing, massage and all those things, and home remedies are good, but the home remedies, if you don't know which type of home remedies are good for your skin, they can adversely affect your skin. So those are the very important things.
Okay, very important. Okay, thank you so much, doctor, for giving us those wonderful messages at this point in time. And I'm sure the viewers who have watched our show must be benefited with the answers the doctor gave. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.